Hi, my name is Tori Johnson, and today I'm going to be performing a skill of inserting a Foley catheter. Throughout this entire skill, I'm going to make sure to maintain all GPSP guidelines. I'm going to educate my patient on why they're getting a Foley and get their consent. I'm going to assess name and date of birth and allergies. I'm also going to assess any reasons that we would have complications with the Foley, like past catheter insertions, or any reason that it would make the skill more difficult. So at this point, I'm going to perform hand hygiene. I would greet my patient. This time I would do all education and assessments, and we will get started with our basic peri-care. I'm also going to really want to make sure that my patient does not have any latex, plastic allergies, anything like that. So I'm going to go in with soap and water approved by the facility. Go in side, middle, using a new part of that rag every time. Okay, we're going to go in and dry. Side. Okay. Remove my gloves and perform hand hygiene again. And at this point, we are going to move into sterile technique. So I'm going to check my packaging, make sure that it is unopened, untampered with, dry, and within the expiration date.
I'm going to be performing the catheter scan. The first thing that I would do is start the evaluation.
At this point, I'm going to perform hand hygiene again and get ready to don my sterile gloves.
So I'm going to perform hand hygiene. I want to get the supplies put out. I'm going to put my hand.
Sterile. I'm going to gather all of my supplies. Go ahead and open my cleaning swabs. Open my lube. And I'm going to insert this into the lube and save that for later. Now that I have all of my necessary supplies, I'm going to go in with my non-dominant hand and identify the urinary meatus on my patient. Okay. And I'm going to go in with these swabs. I'm going to clean around that meatus from side to side. And then middle, being careful not to contaminate my sterile hand. Then I'm going to take the tubing out of the lube, and I'm going to go in at the meatus and insert that there. Careful watching my sterile hand to not bounce back off of the vagina. I'm going to assess with my patient this entire time. Once I start to see urine flow, I will go in 1 to 2 more inches. Stop that there, and then hold that catheter. Okay, I'm going to inflate that balloon. After I've inflated the balloon, I'm going to go in and give that a little tug to make sure it's stable. Remove that.
So gloves.
And at this point, I would attach my catheter, making sure that there's no kinks. Right there to my patient's leg. I'm gonna make sure there's no kinks in the tubing, making sure that that is secure. Okay, that is secure. No kinks in my tubing, so we should have good flow. I'm going to connect that to the bed on a non-moving part of the bed to make sure that it is secure. Okay. And I'm also going to make sure that that is below the bladder of my patient. So then I will clean up all my supplies, perform hand hygiene, get my patient more comfortable, reassess with them to make sure if they have any questions, concerns, anything like that that I'm here to answer. I would report and record, lower the bed, and leave the call out with my patient.